Good evening, everyone. We are gonna we're gonna be live today on Facebook and Instagram. So we're gonna give a second for Facebook to catch up with us, and we will go from there. Thank you, everybody. Just give us a few minutes. Thank you all for joining us. Dr. D will be joining us in just 1 second on both Instagram and Facebook. Hello, everybody. If you can hear me, let me know. We should be good now on the sound. Good evening, everybody. Just give us a few seconds. We're going to be joined by our health commissioner. We will get to all your questions, as many as possible tonight. Just waiting for our health commissioner to join us. We are now live on Facebook as well. Good evening, Dr. D. If you are in the Instagram, Dr. D, let me know so that I can add you in to it. I don't see a request from you yet. Let me see. There we go. Boom. Good evening, everybody. Thank you so much. Dr. D will be joining us. Hello, Dr. D. How are you, man?
I'm pretty good, Mayor Scott. Again, thanks for having me. Is there an echo? Let me fix that if there is.
No, man, there's no echo. Thank you so much.
Okay.
Everyone in the comments is saying the audio is good. I am going to say thank you all for joining us again for another edition of the 410 report. I'm joined tonight, of course, by our Health Commissioner, Dr. Dzirasa. We are on both Instagram and Facebook tonight, giving you the latest update on COVID and more specifically the Omicron variant and how it's impacting us both in a physical sense and a health sense, but also impacting our world. So thank you all for joining us and for tuning in again. As always, this is the 410 report with Mayor Brandon Scott. I am joined by my most frequent guest, our Health Commissioner, Dr. Dzirasa. Before we start, I wanted to say just a few things to both our folks on Instagram and Facebook, just to let you guys know. For everyone that has gotten vaccinated, thank you. Who've gotten boosted, thank you. And for those who got tested before and after traveling during the holidays and attending gatherings, thank you very, very, very much. And I want us to continue to do that as we move into the new year. I also want to acknowledge for everyone, we know that we are seeing lines at testing sites extended lines and testing sites because of the big surge and the big interest in that. And to meet that increased demand, I am pleased really to announce that we'll be standing up additional testing sites throughout the city over the next few days and weeks. Thanks to a partnership with one of our Councilman Seifert, we are standing up a new testing site at the former police academy at 3500 West Northern Parkway that will begin testing operations starting tomorrow. And we're also working to expand our home testing pilot so that we can provide increased access to communities facing the highest levels of COVID disparities. We've actually ordered over 100,000 of those tests, and as they get them in, we will be distributing them through our community partners to protect us and get that information out. I also want to remind folks while we're doing that, that those who should avoid crowds and those things that we say consistently, and that we still have an indoor mask mandate. And that helps, and we know that it helps a lot. And we want to make sure that everyone is following that rule. If you see places that are not forcing folks to do that, you can always let us know through 311. We are, and Dr. B is going to talk about that more specifically in a second, seeing a significant surge in infections, but we all have to do our part. And that's wearing a mask. That's, of course, doing the basic things of washing our hands, distancing, getting tested, getting everybody that you can vaccinated, and we want to make sure that we are getting that information out. So you can always get that information from us at covax.baltimorecity.gov. We're going to make sure we continue to get that information. So I am now going to bring in our guest, who really is not a guest, more like a co-host now of the 410 report, and Dr. D. And Dr. D, as we start, and I know, and please be sure to put your questions in the chat. We're going to get to as many of them as possible. We're going to have another special guest that is coming on after Dr. D today, and Dr. St. Alicia from the school system. But Dr. D, can you talk about Omicron in general and how it's impacting the city right now?
Absolutely. Well, again, thank you, Mayor Scott, for having me. First of all, I want to talk about what we do know, right? So we know that Omicron was announced as a variant of concern by the World Health Organization and subsequently the CDC. And the reason why is because it is a highly transmissible variant of the coronavirus. So it spreads very easily from person to person. Initial reports are suggesting that the symptoms it produces are a bit milder. However, for unvaccinated or partially vaccinated population, there is still a risk, a high risk of hospitalization, severe illness, and death. We know that that is lowered even with Omicron if you're vaccinated. So to be clear, it doesn't necessarily mean that you are completely immune to getting the Omicron variant, but it does mean that your symptoms will be significantly milder if you're fully vaccinated with that booster dose. It offers a level of protection. So just a reminder for everyone to get vaccinated and get your booster if you're due. Again, what we're seeing and what is of most concern is that if you're unvaccinated, your rates, your chances of having severe illness from COVID are significantly increased. So 6 times more likely to test positive if you're unvaccinated, 9 times more likely to be hospitalized, and 14 times more likely to die from COVID-related hospitalizations when you are unvaccinated.
And Dr. D, and I think that those numbers are tremendous. Can you also talk about, like, you and I talk to our hospital partners a lot, the difference between the amount of folks who are hospitalized with COVID with the vaccine versus those who are not, for us in the city, and how that looks across the city?
Yeah, absolutely. The vast majority of individuals that are hospitalized with COVID are unvaccinated. Anywhere from 80% and upwards are unvaccinated individuals. And those that might be vaccinated and hospitalized often have an underlying comorbid condition that might place them at greater risk. Again, vaccination is key to helping prevention and to really reducing the severity of symptoms in the event that you do get COVID.
Right. So I think it's important for us to always say that nothing is 100% perfect, right? We know that, right? Whether it's the flu, whether it's regular medicine that you get, but you're talking about the severity. So for those who are not hearing that, right? You are 14 times more likely to die from COVID-19 if you are unvaccinated. You are very much more likely to end up in a hospital on a ventilator if you're unvaccinated. And it's about keeping people as healthy as physically possible. Dr. D, we know, I know that the state data was down recently because of a data hack. And now that state data is starting to become available again. What does that look like for us in the city? Walk us through our metrics and our current data points.
Sure. We are beginning to get some internal data feeds from the state. We're not yet able to completely pull down and update our dashboard, but we anticipate that happening soon. But what we are getting is that our COVID incidence rate right now is at an all-time high. It is the highest we have seen it during the entire pandemic. So our new case rate is nearly 4-fold higher than our previous peaks. And hospitalizations, too, are also alarmingly high, COVID-related hospitalizations. So as of today, we had 550 COVID-related hospitalizations in Baltimore City, up from 493 just yesterday. Just yesterday, we saw an increase up. And this, again, is the highest we've seen COVID-related hospitalizations in the city since the start of the pandemic. And our current percent positivity is 24%. So again, well above the 5% threshold. So all of these things are concerning, and we anticipate that things could potentially get worse for hospitals based on the case rates that we're seeing now. And that's concerning for so many reasons. Obviously, we want people to be healthy and safe. But if we get to a point where we have oversaturated our hospitals and they are completely shifting towards what we call crisis standards of care, it means that they can't provide care for other illnesses in addition to not being able to provide the care necessary for COVID patients, right? So, in the event that someone has a heart attack, or you fall and break your arm, or you have appendicitis, some common things that are still happening amidst this pandemic, there is not enough support to be able to also provide care for those things.
Yeah, and Dr. D, I think it's important too, just because I think this is going to continue to come up, and I think at some point we have to be real and honest with everyone. I know that there's a lot of misinformation being spread about who's dying from COVID and who's not. Can you talk about a couple of things for me? Talk about right now what age groups are the leading drivers of COVID cases in the city of Baltimore versus the age groups that are the driver for those who are dying from COVID. And then also talk about, again, just to reiterate so that folks hear and understand and get past the ignorance of the information that's being pushed out by certain people, that by and large, overwhelmingly, it is not vaccinated people that are dying from COVID. This is now, being really sick or not is really now a decision of whether you're vaccinated or not. Can you walk us through that?
Absolutely. So again, looking at the data for the month of December that we have, the largest number of cases were in our 20 to 29-year-old age group, followed by our 30 to 39-year-old age group. And so again, largest number of cases amongst this age group. As far as hospitalizations, and that information we have more accurately from November, it was 60 to 69-year-olds were the kind of the leading group in terms of hospitalizations. And it was individuals, again, who were either partially vaccinated or unvaccinated altogether. And so we know that there is a risk if you're older, if you're not fully vaccinated, if you're partially vaccinated, and if you have underlying comorbidities. But again, unfortunately, we're seeing these high case numbers in this age group of 20 to 39, and it can be transmitted. So even if you yourself experience mild symptoms, you can place others in your life that you love at risk because you contracted it and you go hang out with your aunt or uncle or your neighbor or your grandparent, and they get it and they don't have that same level of protection, or they have other health issues that put them at greater risk.
Thank you. Thank you for that, Dr. D. Too, I just want to remind everyone, like, if you have specific questions for Dr. D and I, to put those into the chat. There's a lot of comments coming in, so we're going to get to as many of them as possible. So just want to, we're going to have time for that in a few minutes. Dr. D, also, I just wanted to, we know that there's been a lot of conversation over the last couple of days, really the last 24 hours, around the CDC guidance and isolation and quarantine. Can you walk everybody through what the new guidance is, whether it's different for people who are vaccinated, unvaccinated, all of those kind of things?
Yeah, so I'll start by quickly delineating isolation versus quarantine. So remember, isolation is for a person who is known to have the disease and is subsequently separating themselves so it's not passed on to others. Where quarantine is if you've been exposed to someone with disease, or if you are exposed to someone with symptoms and you're trying to wait and see if you develop disease, that's when you quarantine. So starting off with the isolation update. And this is applicable for whether you're vaccinated or unvaccinated. The CDC shortened that time from 10 days of isolation. So say you have no symptoms and you test, if you happen to test and you test positive, it used to be 10 days from that positive test. Now it is 5 days from that positive test if you are still not experiencing symptoms. And subsequently, the next 5 days, you should be masked when you're around others. So it's still that 5 days of isolation. This is assuming no symptoms in a vaccinated or unvaccinated person, and then 5 more days of strict mask wearing around other individuals. And I just want to say the reason why they shortened this is because much of the data indicates that you are most infectious or most likely to spread the 1 to 2 days before your symptoms start, and then the first 2 to 3 days after symptom onset. That is when the majority of individuals can spread the disease. And so they were trying to capture that highly infectious period But recognize also that we're seeing critical working shortages across the country because the isolation period is extremely long. And if you're not experiencing symptoms, you're much less likely to spread. So then the second thing they did was they updated the quarantine recommendation. So again, if you've been exposed to someone with COVID-19, so two separate things. If you're unvaccinated or you're 6 months out from your Moderna or your Pfizer, and you haven't gotten your booster, again, now it's quarantine for 5 days. So quarantine for 5 days and then strict mask use for 5 days. Alternatively, if you can't do this, for whatever reason, then they're saying that you as the exposed person who was only quarantined need to wear a well-fitting mask for the next 10 days. And then after this, I'll talk a little bit about mask guidance. And then again, if you have received your booster, so you're fully up to date, you've gotten that booster after the full series, then you don't need to quarantine following that exposure anymore. So that's a big change. Instead, you should wear your mask for 10 days after exposure. So again, quarantining, if you're unvaccinated, partially vaccinated, 5-day quarantine, 5 more days of strict mask use. Fully vaccinated, meaning you've got your boosters, then it is 10 days of just strict mask wearing. You don't have to be at home by yourself. So that's a pretty big change. To quickly touch on mask wearing still remains a very important way that we can all reduce transmission of disease. You should wear either a double mask, as we know Mayor Scott does, or a KN95 if you have access to that. And it should be well fitted over your nose and your mouth.
No, thank you. And Dr. Day, because we know that this just came down from the CDC, can you talk about when we think that this will be implemented in Maryland and how that process has to happen?
We work closely with the state to update guidance. We believe it will be incorporated fully into the state's guidance, but we want to make sure that we fully understand it. I think throughout this pandemic, we've seen guidance come from the CDC, and we want to make sure we're interpreting it correctly so that we can appropriately apply it to our population. But I anticipate that this guidance will be fully accepted by the state, and you'll subsequently potentially hear a shift when we call to do contact tracing. When the state calls to do contact tracing, that's usually when we're giving this guidance, and so that's when you'll hear that shift.
And I wanted to address this because I just saw it really quickly. There was questions about whether we publish our data like they do in other places. Yes, the website is coronavirus.baltimorecity.gov. However, that information is fed to us from the state, and the reason why it's lagging, and all of us across the state didn't have information is because of the state's hack. So we will be getting back to that as they build up. And Dr. D, we know that there's been a lot of concern and questions around how you have been advising city schools, as it's unlike the rest of the city. You and I don't get to just decide what they do, but we have to really utilize your ability and your understanding as the chief health officer to provide guidance. And without the young people set to return to schools, can you share with everyone the recommendations that you gave as our health commissioner to city schools in their leadership?
Sure. I first want to start by saying that City Schools has always been a partner in this work. From day one, when they made the decision to close back in March 2020, if you can remember that far back, many conversations were had. And when they began to bring students back, many conversations were had around how to safely screen and protect students and staff upon that return late in the 2020 school year. So regular weekly calls with the city schools to discuss our data, what we're seeing in young people, what we're seeing in the general population, as well as their data. So city schools internally does their own contact tracing and also works with our teams on contact tracing. So we're also getting much needed data from them to make these recommendations. We did not at this time recommend city schools transition to virtual learning. What City Schools has planned is surveillance testing upon return to school. So really screening, similar to how they do now, weekly screening. They were one of the first jurisdictions in the state to do it. But that screening upon return for all students and staff, and we'll work closely with their teams to ensure that can happen. And again, just, talking through what we're seeing in the data, right? So we know that when we think about case rates, they're high everywhere in the community. But much of the data we've received from city schools on contact tracing is more suggestive that cases are acquired in the community, individuals come to school and they're screened, and then we identify positive cases, maybe asymptomatic cases upon screening. So we emphasize much of the precautions that we talked about in previous 410s, right? Everyone 5 and up should get vaccinated. So this is a strong recommendation for everyone in the community. Family members or household members of students should also be vaccinated. Ideally, families and individuals who work at city schools are avoiding large crowds and large gatherings with individuals outside of their household throughout the holiday period. Double masking, we talked about double masking indoors and public spaces, crowded outdoor settings. When traveling, limiting traveling is ideal. Staying home when not feeling well, getting tested before that return to school. In this instance, city schools are just testing kids upon return, and I know Dr. Sanfelices will discuss that more. Again, offering the routine testing that city schools is already doing, limiting of extracurricular activities over this winter break period. And then if feasible, consider testing your athletes upon return to sports as well during game days. And then re-emphasizing much of what city schools has been doing throughout. Masking, cohorting of students, encouraging social distancing practices at school, ensuring just maximum implementation of all of the safety measures that city schools has had in place this entire time, and encouraging staff that are eligible, as well as students that are 16 and up and eligible, to get their booster.
No, thank you. And Dr. D, and I guess one of the important questions that parents would have for you is that how frequently are you communicating with the school system and talking about the data and what we're seeing as far as cases and those kind of things?
Sure, at least weekly, but often it's more than that. And I want to say that I am not the only individual guiding city schools. I work closely with them, but they have a health advisory group, which includes members of the health department team. It includes physicians at Hopkins and Morgan State that they are also in very close communication with. We work with them closely on their screening and testing program as well. And so there are many data points and touch points between the health department and city schools.
Thank you, Dr. D. Dr. D, before we go into questions that we have from folks who have joined us, do you have anything else that you want to add in?
No, I'm going to plug vaccination again because it really is protective. We have something that can save lives in the vaccine, and I really want to urge everyone, if you've not been vaccinated, to get your first vaccine and to complete the series. If you are due for your booster, please get that booster and get your children 5 and up vaccinated.
All right, so Dr. D, this question, I'll put these first two together. Somebody asked, when will more at-home testing kits be available, and how to best use those home tests? How accurate are they? And we said that we've ordered over 100,000 more, and we expect them to be in soon. Can you talk again about the home testing?
Yes. So Mayor Scott hit the nail on the head. We placed the order for additional home testing kits. And we'll be distributing that through community-based organizations, which is how we distributed these previous kits. At-home testing, or also known as antigen testing or rapid testing, is less accurate than your typical PCR test, which is what most of our testing sites do, right? So I'll start by saying that. That said, if you're experiencing symptoms and you have a rapid test at home, and you can test more than once, depending on the type of test kit, you should, right? So if you're experiencing those symptoms, you should test. If it's negative and you're still concerned, you should absolutely follow up with PCR. So definitely, I view them as a way. If I'm experiencing symptoms, if my child is experiencing symptoms, and I want to maybe get a quick response, and maybe don't have access to a PCR test in that moment, I'll use the rapid test. But if I'm still suspicious, I'm going to follow up with a PCR. And so that's how I would advise folks to think about it.
Well, thank you for that, Dr. D. Someone had another question around how we're dealing with indoor dining in bars. Is there any updated guidance for folks who still are doing those kind of things?
Yeah, I mean, I think the guidance is that, and just because we're experiencing so much community transmission, and I've said this early on in the pandemic, I'll say it again now. Anytime you leave your home and you're engaging and interacting with people not in your household, there's a risk. And that risk becomes higher as community transmission rates increase, right? So, especially, in an environment where, for whatever reason, you might remove your mask. And so that's why the indoor masking is important unless you're eating or drinking. Those would be the only times when you should have a mask off in a bar or a restaurant. And again, you should still be avoiding the large crowds and the large gatherings, given where we are in terms of community transmission.
Thank you. So the next question, Dr. D, I will take this one. Someone asked if there's a hold on landlords evicting people, but it's still behind on rent. If you're having problems with your rent, we have our rental assistance program. I want you to go to beMoreChildren.com. The Mayor's Office of Children, Youth, and Families is leading that work. We have people actually now inside the courthouse to try to intercede ourselves into evictions that are about to happen or happening. So please be sure, whoever asked that question, I can't see your name anymore, but make sure that you go to beMoreChildren.com and let us know. We'll help you in any way that we can. Two I would just put together, just going down these, Dr. D. One was, what can we do to prevent super spreader events, and how does the risk for unvaccinated children under 5 compare to unvaccinated adults, which I think is a great question.
That's a great question. The super spreader thing, again, it's avoiding large crowds, avoiding large gatherings, especially during this time of high community transmission. It is, if you do have to go out, avoiding, again, indoor crowded spaces, but wearing your mask and maintaining that level of social distancing, that 6 feet of distancing between you and others. Washing your hands when you come back in, not going out if you're ill, right? And certainly staying home if you're not feeling well, and getting tested. So early identification is also very important so that you don't go out and spread it unknowingly. So certainly get tested as soon as you can. Now, with younger children and unvaccinated children, what we have seen is that, and this has been the case throughout the pandemic, is children generally have had milder symptoms and have had less risk of hospitalization overall. That is not necessarily the case for a child with underlying comorbidities, so not your asthmatic, your child that might have diabetes or may have obesity, that they could experience severe outcomes as a result of getting COVID. But transmission seems to be a little bit lower in this age group, though again, in the month of November, we saw a shift with more children having COVID, I think in part because that is our unvaccinated population right now. I think as we're seeing Omicron become more prominent, it really is impacting everyone. But again, especially when we think about that 20 to 29-year-old age group, that 30 to 39-year-old age group, who may be a bit more mobile and engaging with more people, that we're seeing, the highest total numbers of cases in that age group.
No, thank you for that, Dr. D. The next one is for me, someone who's a social worker. Thank you for your service, talking about need for more options for our residents and neighbors experiencing homelessness, about many people coming to the ED for shelter and food and the shelter hotline. How can we expand that? So it's Heather, actually. Thank you, Heather, for your question. You will be hearing from me about that. You know that we've already talked about with the Mayor's Office of Homeless Services about expanding things, looking at possibilities of like even buying hotels, all of these things to create more opportunity for our residents experiencing homelessness. Throughout the pandemic, we've actually, with Dr. D and other agencies, been leading in that way, where we've been housing our residents experiencing homelessness in hotels and bringing services to them. We'll be talking in the very near future about how we plan to even take that up a notch, especially knowing with the ongoing pandemic that we're going to continue to have that problem. Next question, Dr. D, is, and I know our other special guest is waiting in the wings now, but can you just reiterate, some folks asked about Omicron being hard to detect, as you just said, on rapid and antigen tests, and people who might be sick should stay home to heal themselves if if that doesn't pop up. Can you talk about again, like what you just reiterating the importance of, even if you feel sick and you test negative on that home test, to get tested?
Yeah, no, so I agree. You hit the nail on the head. One thing I will remind folks too, in addition to obviously being in the middle of a pandemic, this is cold and flu season. And so, we don't talk about it as much, but even outside of a pandemic, if you're not feeling well, you should be at home. And I know that that's not traditionally how we behave. We think we're going to push through and be okay, but that is not the way to go, because you're placing others at risk, even if it's not COVID, right? What if you have the flu? You don't want to pass that on. The flu can certainly be pretty severe in individuals with underlying health issues, or those that might not have gotten their flu shot, and so hopefully you got your flu shot. But the flu, whatever it is, flu, cold, some other virus, we don't want to pass any of it on, right? We want to protect folks. So certainly one identify if it's COVID, so that's where testing is important, and then following the CDC's isolation guidance if you test positive. But we don't want to pass any of it on, right? So keep wearing the mask, keep washing your hands, and really avoid people generally if you're not feeling well.
No, thank you for that, Dr. D. Just a few more. One, I'll try to lump a couple of these together. Some folks had questions again about the testing sites. They may have joined us a little later, talking about the demand, and why aren't there the mass sites that were there in the beginning, and what we're doing to expand that. We talked about expanding it. Can you talk? I said it earlier because you talk about the expansion work that we're doing on testing, and how we're going to be doing that work.
Sure. I mean, I think that, if you look across really the state and the country there, the demand is far exceeding the supply and ability to catch up. And some of that is that over the summer, backing up a little bit, we saw significant decline in testing. That said, we still maintained our testing sites. We had testing sites throughout the city focused on areas with low vaccination coverage, and we still maintained many of those sites. They're now seeing triple, 4 times the volume, even more than that, than they were previously seeing, and they're working to accommodate that. But we saw this significant dip in demand. We kept our sites in place, and then have had to expand. To Mayor Scott's point, we're excited that we were able to add 2 additional partner testing sites, and it should be updated on our weekly schedule, if not later tonight, tomorrow. AccuReference is now doing COVID testing in partnership with Councilman Schleifer, who was very supportive in standing this up. That site launches tomorrow, and we'll be working tomorrow and Sunday of this week. In the future, they're going to be running Sunday through Thursday going forward. So they will be supplying access to testing. Nomi Health, another partner on West Baltimore Street, has also launched a testing site recently. So again, we're working with partners to expand testing now that the demand has gone back up.
Thank you, Dr. S. And this is actually a good question, and I know this is one that I had to ask you personally. So for folks who have, so a couple of folks have asked, if you contracted COVID, when can you get your booster, right? And then someone said, if you recently had COVID, can you get a booster shot? Can you walk folks through that?
Good question. You technically should wait 90 days after contracting COVID, after you've had, of course, if you've had something called monoclonal antibodies, you should wait for a period of time afterwards to get that booster. Just again, to ensure that you get the full protection and full immunity after having had COVID.
Thank you. And thank you so much. So, Dr. D, just to make sure that folks heard that, if you had COVID and you're trying to get your booster, before getting the booster, you should get tested to make sure, because you could be asymptomatic. And Dr. D, what could potentially happen if you get the booster and you're recently infected?
It's not that anything necessarily will happen, right? I think more of it is that you want to elicit the maximum immune response. And if you've just had the disease, you've kind of had your natural immune response kicking in, and you want to really elicit that full response. And it's more likely that it'll be elicited kind of once you've cleared that previous infection.
Thank you for that, Dr. D. And just talking questions for those who are wondering about where you can get vaccinated and tested. The health department, you can always go to the health department social media, Be More Healthy. We post that on mine as well, but also you can always go to COVAX, COVAX.baltimorecity.gov. It has the information about where our clinics are, where they're going to be, where you can get your vaccination and your booster. So, Dr. D, there are a couple of questions about essentially why we are not doing what we decided to do last year, and that's go into shutdowns and restrictions and things like that. Talk about, walk everyone through about the guidance that you've given to me about whether we're at that point or not.
Yeah, that's a great question. So, we are certainly seeing an increase in cases. One of the key differences is that we also have a large portion of the population that's vaccinated. And so this time last year, we didn't have that. And we know that vaccinations, again, offer some level of protection so that the majority of individuals who get COVID, if they're a breakthrough infection, will have mild symptoms and ideally won't end up hospitalized. Again, we're seeing a large increase in hospitalizations in our unvaccinated population. I do think it's still on those of us who are vaccinated to work to protect our unvaccinated, and that's the hand washing and the mask wearing and avoiding those indoor spaces and large gatherings. But again, I think we also have a very large number of people who are now vaccinated, so do have a level of protection that we didn't have as a population last year. I think that another thing to think about is again, we know a little bit more. We're still learning about Omicron, but we certainly know a bit more about how the disease travels and moves than we did a year and a half ago. And we're cognizant that vaccinations work. And our goal is to really keep pushing vaccinations among the population. And like I said, maintain the indoor mask order now while we know that it's protective, offering some level of protection on top of the social distancing and vaccination.
And then this is a good one too. Someone said if they originally got the J&J, should they get? Is it okay to get a 2 series of Moderna, or should they just get a booster?
Just a booster. So if you got the J&J, 2 months after, you can get one of the mRNA vaccines, either Pfizer or Moderna. You don't have to restart the series.
Thank you. Let's see here. We asked the question about the mass testing sites and more testing sites. And this is a great one. And this is for folks who may have missed the health department offer announcement. Is the health department hiring more contract tracers and folks to work around COVID? Can you talk about that investment and what that's going to mean?
Yeah. Well, a couple months ago, we had a great announcement that the city is supporting the health department with $80 million worth of funding to support our ongoing COVID response. So that includes lots of things. That includes ongoing support of our contact tracers. And so as a part of what's called the Baltimore Health Corps program, we hired over 200 individuals to support contact tracing and care coordination as well as outreach for the community around vaccination and testing efforts. So what we've been able to do with that workforce is, as we've seen cases surge, we're able to flex those individuals up. So for a period of time, they might support vaccination, especially in the beginning when we were rolling out vaccination. And then as we're seeing cases surge, we're able to transition many of those individuals back to supporting contact tracing. And so, we appreciate this opportunity and this flexible workforce that can support wherever the need is greatest at a time.
Thank you for that, Dr. D. And I promise not to hold you. Just a few more questions. I know you have work to do. A good question though. Someone asked, are the kids the folks that are transmitting the disease the most? And we talked about that, but they may have missed who are the folks that are contracting COVID the most in Baltimore.
Yeah. So I want to say that it really is everywhere. It's everywhere, right? And I know that sounds exaggerated, but seriously, case rates are very high right now, and so that is across all of the population. That said, our highest case numbers are in the 20 to 29-year-old age group and 30 to 39-year-old age group. So they have the largest number of total cases each for the month of December. It's 20 to 29 first, and then 30 to 39. So that really is a group where they're experiencing a lot of cases. We're seeing cases among children. So yes, we're seeing cases in children as well. But again, that 20 to 29, 30 to 39 have the highest overall case numbers for the month of December.
Thank you, Dr. D. Let's see here. Another one that I saw oh, it's a good one. How do you do contract tracing when you have an at-home test?
Oh, that's a great question. So if you have an at-home test that becomes positive, you can call the health department to report that positive test, and then we provide guidance. So that number is 443-984-8650. So, we are relying on folks to report that rapid test because you're right, there isn't a way to link it back. So, please call us and we can kind of walk you through the process of identifying who those close contacts were.
Thank you, Dr. D. And someone asked, and I know the answer, but what is the info hotline for people for testing for folks to call?
Same number, 443-984-8650. So that is our general call center that can direct you.
Thank you for that, Dr. D. And so we just so folks that weren't here, kid, can you talk about how we will distribute those new in-home kits once we receive them?
Sure. So what we did previously when we had kits is we had a list of community-based organizations, and they went through those community-based organizations that were focused on areas with lower vaccination coverage, as well as went to our partners at Safe Street. The library was one of our partners. We've given them to our syringe exchange site, and also had some kits at our testing and vaccination sites. So we'll continue to distribute through that channel. That said, if you run a community-based organization and you're interested in applying for future test kits, please go to our website, coronavirus.baltimorecity.gov, and under where our little slot that says where to get tested, you can sign up. You can select the link and indicate your interest, and we'll collect appropriate information for you so that when more testing kits are available, we've already got your information and can work on distributing the new test kit that will come.
Okay, Dr. D, can you talk about, we talked about my request to you to have a group look at the indoor Vax passport. Can you talk about that briefly?
Yeah, absolutely. So I've been working with my team at the health department to look at some of the different Vax passports that are occurring across the country. New York City has one. We know New Orleans has one. I think San Francisco, and to see how that could be applicable to Baltimore City. We obviously understand that it's important to also engage the business community. So for over a year now, I've been convening a health and business roundtable, and so we'll be engaging that group as well on what this could look like for Baltimore City, which we know is unique and different from other cities, and how it would work here.
Thank you. And this is something I think is someone just asked, like, if your results come back negative, but you exposed to someone who tested positive, like talk to them about like testing and when they should get testing after exposure, those kind of things. And then also folks have been asking some questions about long haul COVID too.
Sure. So ideally, after exposure, I know we talked a little bit about the updated guidance. You should still get tested 5 to 7 days after that initial exposure, vaccinated or not, right? We know that it can still be transmitted to vaccinated individuals. So really would encourage anyone that's been exposed to someone with COVID for sure or COVID-like symptoms to get tested 5 to 7 days afterwards, and await those results prior to going out, just to make sure. But yes, you should get that test 5 to 7 days afterwards. Now, one thing, again, preliminarily, data is suggesting that if you're vaccinated, and you get COVID still, you're less likely to have the long haul. So that's also a consideration. If you're thinking about getting vaccinated and wondering, well, how is it protective? Initial data again is suggesting that you are more protected against long haul COVID. And for those that don't know, what we've seen is that some individuals who contracted COVID do get long haul COVID and have subsequent symptoms that stay around. Could be related to breathing, could be related to memory or neurocognitive issues for quite some time after that initial infection has resolved. So it's not just that initial illness. There is a potential if you're unvaccinated and get COVID to have symptoms for a longer period of time.
Last two before we let you go. I know we have a limited amount of time left, and we have our other guests in. But these were a lot of these questions I thought were best answered by you, Dr. D. But I think this one is a good one too. What are the risks of children under 5 in daycares, and what do we know about that?
Yeah, I mean, I think that, you know, again, the hope is that our childcare settings, our daycares are putting the safety measures in place, right? And so their staff is vaccinated, which we know is protective for our younger children who aren't yet eligible to get vaccinated. They're cleaning frequently. They're cohorting children together. So again, keeping that same group together. Not all daycare facilities will necessarily have the ability to test regularly, but certainly, as a parent, if you're concerned, by all means, get your child tested, work with your clinical provider to understand what your options are for testing. But again, we want to ensure that those groups are also following the same guidance, and again, trying to keep children socially distanced, masking. So we still recommend masking indoors. Obviously, it's still a mandate here in Baltimore City, but especially in our childcare settings, we really do want those daycare and childcare settings in particular to ensure masking for children above 2. We know it's a little bit more challenging for younger kids. So all of the things that we're certainly asking all of us to do in our personal lives, really translating that to that daycare setting.
And then the last one for you that I'll try to jump in jumble a couple of them together, Dr. D, is one again is another question around like why we're not going back to restrictions and things. And I'll start by saying that we know that I will not hesitate when Dr. D says that we should do it to do it. But as of right now, as she just said, and I'll let her speak for herself, we the data and the science doesn't call for that as of yet because we're in a different place than we were last year. But Dr. D, there's also questions that are kind of related about how we used to have the convention center open and what the people that are catching it what percentage are asymptomatic and why we have to rely on the state for data. Can you explain to folks like kind of put all of those together?
Sure. So the first part of what you said, we have a much larger portion of our population vaccinated. I mean, at this time last year, maybe we had some healthcare workers that were vaccinated around this time last year. But prior to losing the data, almost 73% of individuals 12 and up in Baltimore City had a first or a single dose of the vaccine. And I would guess now we haven't had access to that data cleanly in a little bit, but it's even higher. And so we know that vaccinations offer a certain level of protection, and that unfortunately, largely what we're seeing is an increase in hospitalizations among our unvaccinated population. And so we really want to, of course, focus on how do we get our unvaccinated population vaccinated. We're going to see an increase in cases, and there are going to be breakthrough infections. That's certainly what we're seeing. That individuals who are fully vaccinated, even boosted, are getting it, but they're experiencing much milder symptoms generally, and they're not requiring the hospitalizations. Again, we are still encouraging mask wearing, distancing, avoiding large crowds, and avoiding large gatherings. For the latter part of the question around testing and how we work with the state, is that ultimately the state is the keeper of the data, and we have always had this working relationship with the state in terms of all disease data. They're the keeper of the data. It's reported to them as the state health department. They report it up to the CDC directly, and we receive our data feeds from the state. And so we have had still access to hospitalization data, and so that's we have been able to track that, as well as some access to case data that's becoming more available now as well. And we're hoping to update our dashboard soon to reflect that. But it is ultimately a state-based system where labs report into the state, and that's how it's reported back out to us.
Thank you. Thank you, Dr. D. As always, I know you will stay around in the background. I'm going to try to get to Dr. St. Alicia's because I know that there are a lot of parents and folks who really want to hear from her. But thank you so much for joining us both on Instagram and Facebook, man. Thank you, everybody. If you give us 1 second, I am going to try to find Dr. Sandalisis on Instagram and on Facebook. Dr. D, I'm going to ask you to cut your video off so that you go away. Let's see. Oh, there we go. All right. Dr. Santelises, can you hear me, man?
I can't hear you, Mayor.
If you can shut down one of your devices, there you go.
Is that better?
Yes, ma'am, it is. Thank you so much. Thank you for joining us today, tonight, and I hope that you and your family had a great holiday. Actually, it's still on the end.
Is that better?
Yes, ma'am.
Okay.
You're good. Turn it down just a little bit more, Dr. S.
You can tell I am not as proficient in Instagram as Dr. D and you.
Dr.
My
Yeah,
apologies.
Dr. D and I have done this a lot, so we're experts at working two devices at once. I would just say, Dr. S, if the phone is it the echo on the phone or on the, I would say cut the phone down and maybe just cut them both down a little bit. But it seems to be fine now.
Okay, good. As long as it's fine now, I'm fine.
All right, great. Well, thank you, and thank you everyone for staying with us. We're going to switch over now to City Schools. CEO Dr. Sonia Santelises. We all know before I kick it to Dr. Santelises to give her brief update and take some questions. We know that the CDC has really set the standard for all of us by saying that school should be the last setting to close after every other preventative measure has been taken in the community and have been employed. We have to work to make sure, and we all know, we all have concerns, and this is why I am having this conversation tonight about trying to answer as many questions as we can in the limited time that we have, but also that we know that we have to have our children be educated, and we know that school is the best place for them to do that. So, Dr. S, before the break, you guys release your plan for how you guys are going to be dealing with the return. Can you, for the general public, walk through that, what you guys have considered, the conversation Dr. D talked about, the advice that they give, and that plan, because some folks, may not have heard as it was around the holidays.
Sure. No, thank you, Mayor Scott, and it's great to come after Dr. D because she really, I think, laid the groundwork as our chief and a health professional in the city. So one of the things that we decided right before break, because we saw the increase that everybody's experiencing, we made the decision that we would delay the return from winter break, from our December break, from January 3rd for students and teachers to January 5th. And that was to enable teachers, high school students, time to be tested before we return. So the plan is that on Monday, this week, so this January 3rd, students will not have class. Teachers are not required to report to school for work, but we will be sponsoring testing for high school teachers and high school students on Monday, January 3rd. This is optional. We know some people will get tested in other ways, but we wanted to make sure we made testing available. On January 4th, what we announced and what will be occurring is that elementary school staff, teachers, school-based staff will be able to come in on January 4th to get tested. Those will be rapid tests. So we have enough rapid tests for staff to be able to get tested, and they should know within 15 minutes whether or not they are positive. Any staff that does not have their test results on Tuesday. Are you able to hear me okay?
I can.
Okay,
yeah.
just making sure. Okay, and then any staff member that does not have the results of their test will be then returning on Thursday. Students will have testing when they return on Wednesday, January 5th. And so one of the things that we have done is we have shifted our testing to be able to test students on the Wednesday they return. Because one of the things that we have found is that we are able to reach more young people when they're in school for testing. And also just a reminder that parents, families, guardians, we need release forms for your students to be tested. So this is just a plug. If your child does not have a signed consent form, please make sure you send that consent form. You can go to our city schools website and we will make sure that we get you that consent form. So that is part of the plan as well for students. And then the following week, we will resume the same weekly testing that city schools has been employing for the entire last year plus. So that's generally our update for right now. We're also going to be making sure, I know that there were some questions from elementary school teachers. You should hear from your principals on Monday about when elementary school-based staff should come in on Tuesday, because each school staffing is a bit different. And so that's why we're having it organized by school.
Dr. S, just a couple of follow-ups to what you said there. So the testing for high school teachers and students on Monday, it's optional for both teachers and students. I know that's been a question that folks have been asked. So it's not a mandatory thing. It's optional for the teachers to get tested, and they can get tested in other ways if they choose.
That is right. That is correct, Mayor. Yes.
Okay, and Dr. S, Dr. D talked about the pool testing, and then I know the question. Talk about the decision and about doing the pool testing versus trying to test everybody, and how what you just said about the slips, consent forms, how all of that plays together.
Yeah, so we went with pool testing at the elementary and middle school level. So K-8 schools do pool testing. What we had found through, I'd say, the majority of the spring, as well as during the fall this year, is that we were able to look at a pool of students, which means a cluster of students take the test, a cluster of individuals take the COVID test. And then if that whole pod is clear, then we don't need to do follow-up individual testing. In the case that a pod or a collection of tests comes back and there's a negative result, then we do a follow-up test for everyone in that pod. One of the things that we are moving to is to make sure that we secure rapid tests to be able to give to, folks, students, anyone who is in that pod. We did that initially because it was a way, less expensively as well as more efficiently, instead of needing to do individual tests for younger students. We did that. Now at the high school level, we do individual tests for each student, very much similar to the one that I took last week. And that is, you basically get a little device, you spit into the tube, and then 24 hours later, you get the results. The high volume of testing, I will say, has caused some delay in that because of the increase in testing. And we are working to get more rapid tests. But as Dr. D, I think, mentioned earlier, we know nationally, and I know you know this, Mayor, that there's a high demand for those rapid tests, but we are working with our partners to get more of them.
Yeah, no, we know that we've been ordering tests ourselves, so we understand that. Early on tonight, Dr. D and I discussed really the need for vigilance really around mitigation, including wearing high quality masks, N95 masks. Talk to me, Dr. S, about the mitigation stuff that you guys are doing in city schools and stuff you have in place, specifically like decontamination efforts, distancing and masks, but also PPE, soap, or sanitizer, all of that stuff.
Sure. So one of the things that we've been able to do.
Oh, sorry, Dr. S. And also, I'm just going to say, I just got a note. If you can, one of your devices is still kicking an echo. It's not doing it for me, but if you could turn one of them down even a little further before you respond.
Okay. Is that better?
Good for me.
Okay, well, let me know if it's not again, and I'll try to go lower.
Yes, ma'am.
Good. So back to the mitigation strategy. So one of the things that we continue to do is purchase PPE so that schools have masks for students who did not have masks. Do not come. I will say large numbers of students are coming to schools with masks. Some of the other mitigation strategies or things that we have in place, as Dr. D referenced earlier, and as we've been talking about, is the weekly testing, which is really important. The other piece, and this is something that I know the BTU brought up to us and flagged for us, and that was to make sure that our filters, the air filters, which we know is really a key part to making sure that the transmission is mitigated of the virus. So what we have done is we have checked all of those. We've been looking at that over break, going through work orders to make sure that those are in place in terms of cleaning of schools, which I know has been an ongoing issue. We are centrally providing all of the products that schools need so that a school is not necessarily kind of dependent on their own individual budget for that. If folks have questions about the cleanliness of their school, they can certainly let us know, flag it for us. That's one of the things we've been saying. If you are in a school where this is a challenge, then let us know so that then we can follow up on it. We've also heard from folks that, again, similarly with the filters, we have gone back with principals to see if there are any filters missed. We're going back over that. We also invested early in electrostatic, I think that's the name of it, cleaning devices to make sure that after outbreaks, we've been able to implement that, to do that extra layer of cleaning. But again, if there are challenges at your individual school, if individual schools are low on supplies, part of the reason why we have been working centrally is to be able to deploy those. So this week, there were challenges with filters, and we have folks out in schools this week in between going back over all of those flagged instances so we can make sure we're covering every school.
Well, thank you. Thank you for that, Dr. D. And then we're going to get to questions in a second. The last thing that I have is that inevitably we know that we're going to see some cases. Talk about the flexibility and things that you guys have about how you're going to work as you have been now with particular schools and folks that when things do happen.
Yes, and we do know it's a challenge. It's a challenge across the state. It's a challenge across the country. We know that with COVID, with some of the quarantining and isolation provisions, we know that there are instances where schools can be understaffed. And in some of those cases where particularly we are experiencing, as Dr. D said, the same uptick in cases that the city, the state, and the country are experiencing. And so one of the things in some cases we've done, and this is why we remain flexible, is that in cases sometimes where the staffing is at such a level that the school cannot accommodate those staff absences, we have either switched that school to virtual or close that school for the day. So part of why folks have been hearing in the news some schools is because we really are looking at a case-by-case basis based on what the conditions are at that school, at a particular school on a given day. And so we'll continue to do that. We'll continue to be flexible. And frankly, we've also been partnering more, even more, I should say, with our community partners. And so one of the things they have helped do is provide extra adult supports for students, extra adult supervision when we know that schools are in a challenging situation. And in some cases, there are examples over the past couple of weeks, even before break, we have had some schools have to take a day or two, either in virtual just because we know that the staffing is challenging.
Thank you very much. All right, man, we'll get to what I call the best part of these. Get to as many of our questions that we can. The first one I have is someone asked, do teachers need a negative test to return to work, and how does that work for them?
Yeah, so what we're saying to teachers is that everyone should be tested, and if you are negative, if you are positive, then you should follow the guidelines for quarantining and isolation. So yes, we're requiring, we're asking staff to make sure that they're tested before they return. But part of why we are taking these days, January 3rd and 4th, part of why we made the adjustment is we wanted to make sure that everybody had the opportunity to be tested and to get those results back before they were required to be back in school.
Thank you. Another one was about health department specific recommendations for the school system. We know that Dr. Lee addressed that earlier, but that we're going to actually said earlier, we're going to be putting that out for everyone to see. So you'll see that on social media later this evening. Next one was a question that does the health department have the current updated information on the results, the data from BCPS and everywhere else really. It hasn't been updated since the start of December. So I'll take this one, Dr. S. Dr. D talked about that. We know that the data comes into us from the state, and we talked about the data breach there. That information is now starting to matriculate more, so you'll see more and more of the stuff be updated as we're able to get that information from the state, who, as Dr. D said right before she left, is the holder of the data. So we'll be updating that information and figuring out more ways for how we can communicate those things in the public. This is a great question. So when someone asks, what if parents refuse to sign the testing waiver? What happens to their children?
Right. So as of now, if a parent does not sign the waiver for their student to be tested, then currently they are not tested in city schools. So one of the things that we are seeing is far less high school students having the consent forms to be tested. So this is yet another plug for families to please send in the consent forms. Please let your schools know that you are consenting for your student to be tested.
Thank you. And Dr. S, someone asked if corporate and nonprofit partners have been engaged in your guys' fight against COVID.
Yes, and I think one of the places where our nonprofit partners have been incredibly helpful has just been in more people on the ground who have relationships with young people, who know how to engage young people, who are in our schools now, really supporting, providing some of those activities. One of the things, and I talked to one of our partners, Mama B, earlier today, and one of the things that she said was, Dr. S, there are kids out here who, if they are not in school, they are not coming back. You will not see them anymore. And a lot of our partners, our nonprofit partners, have been the ones who are connecting, reconnecting with young people who were not in school for 18 months. They are the people who are helping us make the connections, who are building the relationships. Our corporate partners have been wonderful in coming alongside in making sure, again, some of the early extra dollars for technology before the federal dollars came in. Our corporate partners were really great in raising some of that early money and making sure we had that federal dollars have come through on that. And this really is about the community recognizing that our young people, the majority of our young people in Baltimore City, and for those who are working with them, know that a lot of our young people, the overwhelming majority of our young people, need that adult connection in school with regards to the relationships and staying connected, and that education is important for that. And so that's where a lot of our partners, again, particularly our community-based partners, those who lead community-based organizations, have been particularly helpful.
Thank you for that, Dr. D. The next one is actually one for me. It's not related to COVID. I think it's important. I'll just address it very quickly about increasing employment opportunities for young people in our city. So yes, is the answer. We are doing that with you. We just announced a few weeks ago through our ARPA funding the biggest investment into workforce development that Baltimore has ever seen. And that includes expanding during our first time ever having a year-round youth works pilot and work to train up our young people to make sure that they are able to provide for themselves once they leave school in Baltimore. So we will definitely make sure that you can find it. If you go on the Instagram, it's there. I think that question came in via Instagram. It's there. Just scroll down a few weeks and you will see it there. So next question is, Dr. D, will the school system be giving out tests and masks, and what kind of masks, and how are they going to be better masks, the quality of the mask?
Yeah, so one of the things that we are looking at now, one, we've been giving masks out since we returned back to school, so that will continue. We will be working with the health department and with our medical advisory to take a look at masks, given some of the new and additional guidance. So we will be doing that as well. And again, we're going to be in constant contact. The regular contact that Dr. D said will continue. It's been there from the beginning, and it's going to continue. And so we're going to actually take a look at some of that guidance around masks, but we'll continue to make sure that young people and staff have access to that.
Thank you for that as well, Dr. D. And someone asked about the reporting. Someone asked, a teacher actually asked about the reporting. What happens when you guys get cases and how you report that up to the health department and other folks? Can you walk folks through that?
Sure. So we actually have a team of folks who enter the data. I will say the last couple of weeks with the surge, there has been some delay in the posting. One, because we had delays in getting some of the results back. Two, we had far more as cases increased. So we will be updating. We're still committed to updating the site. So what happens is we get those reports, that data goes to the dashboard, and then that data we review with the health department and match it up with what the health department has for the data. And as you noted, Mayor, the challenge with the states, with the state's data has made that comparative review a little more challenging the last few weeks because the state's data wasn't online. But that's what we do. We take our contract tracing. There's been some delays in that, again, because of just the rapid increase. But then we do share that data and review that both with the health department and the health advisory just about every week. We review that data.
And then this is actually a great question. What about immunocompromised students and teachers?
Right. And so one of the things that we have had from beginning is we actually have had provisions for particularly staff who are immunocompromised to be able to petition for a work accommodation. That gets reviewed. We've had a number of staff apply for accommodations because of that. We have a review team. That answer comes back. We did have a number of families, immunocompromised students, opt for our virtual learning program this past year. So we have some students who are part of that program. It did require that students be able to demonstrate success in virtual learning. But we also know that moving into the new school year, we'll need to make more spaces available as well for that. But those are, and we do have individual schools I know that are making some accommodations for those students.
Thank you, ma'am. We talked about this earlier with Dr. D. The CDC just changed the guidance around quarantine and isolation. Eventually, is this what the school system will be following for students and teachers?
Sure. So as of right now, in our most recent communication with staff as of December 23rd, we actually were still holding to the 10-day, the 10-day quarantining and isolation. Because of the new CDC guidance, that's one of the things that we are now reviewing along with the health department to see about those adjustments. But as of the December 23rd letter, we're still with the 10-day.
I just want to remind everybody that, remember, also, this is something that's a decision that also the state itself will be having a lot of influence and discussion over it as well. The next question was about the health and safety coordinators and how folks know, like, if they have the appropriate number and if, that kind of thing.
No, that's a great question. And one of the things that has been challenging is we do know that there are some schools that, had a health and safety coordinator who then left to do something else because of the demand for people within the medical field. So what we have tried to do is really keep track of where there might be gaps for health safety coordinators. We just established a new basically COVID response team because the level of work it takes to monitor COVID and mitigation efforts and respond to requests really requires a dedicated team. So within that team is monitoring and taking over and actually working with our human capital office to recruit more health and safety coordinators. But they have been very helpful because in other school districts, it really everything falls to school staff when it comes to this follow-up. So we remain committed. That's one of the ways we're using our federal relief dollars is in the hiring of those health and safety coordinators.
Thank you, Dr. Day. And there are a couple of questions that you talked about the testing. Just questions about the capacity and if you're confident that you guys will be able to do all the testing of everybody in that 2-day period.
That's what we're working towards, and it's absolutely a fair question. So one of the reasons why we decided to delay the return from winter break for students until Wednesday was to give more time for folks to get tested. It's also giving us more time to front load and increase the capacity to test as many students as possible on Wednesday. So we had a regular testing schedule for city schools that, again, we've had for the last year. This week, what we are working on is making sure that we actually have more folks to dedicate to the front loading. It does mean, look, we're gonna, we're working to make sure that happens and that we do that efficiently. I would say that there are people who are already getting tested on their own, but that was part of the decision behind the December 23rd plan that we released, and that was part of what we were working on that week to make sure that we actually could get as many folks tested as possible that week, and those 2 days give us more time to do that.
Thank you, ma'am. The next one is actually for me. It's about Rec and Park. So yes, I suspended Rec and Park sports programming for a period of time. I just thought it was the right thing for us to do. It actually impacts me personally. It means that I won't have my winter basketball league that I normally play in, and we're looking forward to working with Director Moore to see how we can restart that critical sport programming for them. And that leads into a question, Dr. Esther, someone had for you about how the plan for winter sports for you guys.
Great. So as of right now, we actually paused on school sports during the break. So as Dr. D referenced earlier, sports tournaments that were to occur during the break, we actually, we actually canceled or stepped aside from that. One of the things that we are working on is really looking at how we test our athletes regularly and making sure that they're tested regularly, because we also have a vaccination requirement for city schools athletes, which again is a little different, from other leagues and other places. So as of now, we're still reviewing and watching sports. We are enforcing the vaccination requirement for athletes and the testing for athletes. But we, like other jurisdictions, are going to be monitoring that as we go. But as of now, again, our athletes have to be vaccinated in order to do that.
Dr. S, I have a bunch of more questions, but I'm trying to push them together because I know I have it at 11:30 in a few minutes. But I think that there's a couple of ones I'm going to try to put together that I think are very, very important. One, I'll just answer because I know we've done this before, but I'll let you talk about it. Someone asked if the district can provide vaccination opportunities at the school. And we've been doing that in partnership with the health department and the system. We will continue to do that as much as humanly possible. Another one is if they tested positive in the last 2 months, does that mean they have to get a PCR test on their own before coming back to work, or how does that work?
No, and let me make sure, just because the volume was a little low. Could you repeat the last question about the PCR test for work?
If they tested positive in the past 2 months, do they need a negative PCR test to get that on their own before coming back to work? Just the guidance that you gave about the employees and how to come back after testing positive.
Yeah, so after testing positive, you should be able to present a negative test before returning. But one of the things that we will make sure that we do is incorporate that in our Q&A that we'll post. So we'll make sure that that's clear for folks.
Thank you for that, ma'am. This is a question I think that we answered, but I'll just ask this again about students being able to come to school if parents have refused to get tested. Talk to folks about how the issues are around that.
Sure. So as of right now, again, what's most important is to make sure that young people are enrolled or have the permission to take part in the school-based testing. What we've seen in cases where large numbers of students are being tested, we are able to catch those cases earlier. As of now, it is not a requirement for students to participate in testing. It is not mandatory, but we have found that when we have schools with large numbers of students being tested, we are able to identify and contain the spread far more effectively.
Thank you, Dr. S. One person just wasn't really a question, but more a suggestion that if the guidelines change with the CDC, that they want to make sure that we understand that they would appreciate us being really clear about asymptomatic versus non-asymptomatic cases, so that information is out there because of it being able. And then there was a couple of questions I put together about what happens when a bunch of teachers at a particular school or somewhere, lots of teachers or too many of them test positive, and what will happen with students when they test positive, if they're elementary, how they will get back home, all of those kind of things.
Right. So in cases where we have either large numbers of students in a class, we have had that class go virtual, right? So we have done that for the last year and will continue to do that. In cases where there are many staff that are out, and that school does not feel as if, and we have those conversations with principals regularly, does not feel like they can cover the number of staff members that are out, we either close the school for the day or we move that school to virtual. Does that answer the question? I'm sorry, Mayor, I have one that's really late. I'm trying to make sure.
I got, yep, you did. That was good. Let's see, a couple more that I can get to, trying to get to the ones that I think that are biggest. This one is just, someone said, just a question about the teacher advisory committee, about and how that work is going with that committee.
Sure. So with the teacher, specifically the teacher advisory committee, correct? Not the health advisory committee.
Yes, teacher advisory committee.
Yes. So the teacher advisory committee, actually, we were identifying new members for the teacher advisory committee. We had some personnel changes in human capital, so there's been a bit of a delay on that. So one of the things that that I am not sure of, I don't know when the next meeting will be, but I do know because of some staffing shifts, there's been a delay in those meetings. So they should, but we did identify new folks to serve on the teacher advisory council, but it has not been, it hasn't been active the last few weeks. And I think that's because of a central staffing change, but we will get that back up and running.
The next one I will take is about a question around about meetings about COVID stuff from between system and health department being open to the public. What I will say is that when you're dealing with people's health information, much of that is protected and you can't talk about that in a public setting. But as I always have, and I know that we've done before, Dr. D will be available to Dr. S, and for folks when they're having town halls or other things, we'll always make Dr. D as available as possible, or someone from her team. But some of the information is just stuff that we can share publicly, but as much as possible to have Dr. D working with Dr. S and the team to talk about things from the health perspective is something that we're absolutely going to continue to do. And let's see, get a couple more here. Someone asked Dr. S around an opt-out model for testing for the students, and if we thought about that.
Yes, no, we have. And that is something that we grappled with, particularly because, as some folks have noted, you know, you're not capturing all of the students, and particularly at the high school level. We don't have the numbers that we would want of young people being tested in every school. So we have, it's a good question. And then depending on kind of where we have the surge, I agree it should be something that we revisited. We did think about doing that, and we heard from a lot of our parent and family feedback that families still wanted that option, and they wanted it proactively, not with what is usually called passive consent, which means you have to opt out in order for young people not to participate. And if you don't opt out, then you automatically participate. And we had some real strong feedback that large numbers of families did not feel comfortable with that. That being said, I think it's fair for someone to surface that as something we should revisit and consider.
Thank you. And the last one I'll just take, just because you answered this earlier about testing and where you guys have testing. Yes, the system is ordering more tests. Everyone knows there's a high demand. We talked about earlier with me having Dr. D order over 100,000 at-home tests for us on the city government side. We will continue to work with our partners to see any way that we can assist in that. But we know that tests are a hot commodity right now, and even when you order them, it does take some time for them to come in. And the last question I will say for you, Dr. S, is just around distancing in school. So we have a bunch of, like 4 or 5 of them around. Mask breaks. How do we protect young people at lunch and class sizes? Can you talk about the mitigation things there?
Yes. So one of the things that has been true from the state's guidance on distancing, it has been distancing at certain lengths where possible. So yes, in cafeterias, and I know that cafeterias, we have some, we have some instances where classes are crowded or people feel that they're crowded. And what we have said to schools is you need to work as much as possible to distance, but it's also a variety and a collection of mitigation. It is not just one thing. And the state guidance is that you need to distance as much as possible. And so part of what we saw throughout the fall was that we were not, seeing the spread because it wasn't in the community. One of the things that we will be reviewing is that distance. But as the guidance currently is stated by the state, we're following that guidance. And that guidance is to distance as much as possible.
Thank you, Dr. S. And I want to thank everyone for being with us. There were folks who stayed with us a long time. I want to thank you, Dr. S. Thank Dr. D. Thank you both for your leadership and for your continued service to our city and our children and our young people. Thank you all. I know that we weren't able to get to all of your questions. We got to as many of them as possible. We want to thank you all and say, have a happy new year. And please, 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 please stay safe, everybody.
Thank you, ma'am.